Hi there, Ironbarkers. Welcome back to the 22 school year. It's an exciting thing to be going back to school, and we want to maintain our kids' interest in that and their excitement as well. I'm sure they'll be really happy to be going back to school to see their friends and their teachers. So, firstly, I just want to acknowledge the custodians of this land, the original First Nations people, the Darug people. I sit here in Western Sydney, just like our school in Western Sydney, the Darug lands. And I pay my respects to elders past, present and future. So before term 1 begins, we've been doing some thinking, and New South Wales Health and the Department of Education have worked collaboratively to come up with some plans, COVID smart plans, to try to keep schools open, to keep learning happening. And that involves things like the rapid antigen testing that you will have heard about, and some of you have picked up tests for. What to do if we do get a COVID-19 positive test through one of those. Reminder about vaccinations and information about our ventilation, use of masks and restricting visitors on site and some of the activities that are still on hold, and how we're going to minimise the spread of COVID within our school to keep our students and our staff safe. So we're taking every precaution to safeguard our learners. And that's within the context of knowing that in the classroom learning is the best place for students to be. That's where their learning journeys will be maximised. So we've got this approach that is going to involve what they're calling surveillance testing. So as it's not a normal start to the year, there might be some disruption to staffing. There might be some teachers who are unable to be on their class for a period of time. They may have to isolate, in the same way that some of our students may have to miss some learning. If they're sick at home with COVID, obviously we're not expecting them to be engaging in the learning. But during isolation, perhaps they could engage in some remote learning through some packages that the Department of Education has available online, and I'll let you know a little bit about them right at the end of the slideshow. But our teachers always work collaboratively here at Ironbark Ridge. Our school leaders and specialist teachers support the classroom learning. And so we may have to support the classroom learning by being in there as the classroom teacher. It might be that your child has Mr. Thomson for a week's worth of learning, as the teacher might be unavailable due to COVID. So our learners and our learning programs are a shared responsibility here at Ironbark, and this places us in a good position to be supporting each other and to be supporting your children, even when perhaps we're not their normal classroom teacher. So as I said, these rapid antigen tests are being provided to staff and to students. Surveillance testing is what they're calling it. What it means is we want to try and pick up cases of COVID before they enter the school and sit in the classroom for a day, before symptoms appear, if possible. So obviously we're looking for symptoms, but these tests will allow us to find some asymptomatic cases where students don't appear to be sick at all, and it would be best to capture that, as I said, before it comes to school. So during the first 4 weeks of term, students and staff are encouraged to be a part of this surveillance testing program. That's why the tests are being provided to you. The testing will be done on a Monday morning and a Wednesday morning before attending school. And so for this first week, you might do it on Monday afternoon, Monday evening, once you've picked up your tests. And if you're coming up tomorrow to get them, you haven't got 4 for your students yet, then Casuarina and Blue Gum families in the morning from 9 till 12, just to avoid a bit of congestion. We're splitting in the school into 2 halves, just so that you can turn up 9 till 12 for Casuarina and Blue Gum, hopefully less people. Spread yourselves out. It won't take long. The tests will be handed out by our friendly office staff down outside the hall area. So just come down the pathway and wait patiently there. It won't take long. Waratah and Wattle after lunch from 12 till 3 p.m. And if you're struggling to get there at those times, please send us an email or give us a call, and we'll arrange a later time in the day on Monday afternoon for you to perhaps pop past and pick it up, or I'm sure we can come to an agreement over it. So just give us a call. So those RAT tests obviously have instructions in them, and there's translations and things available through New South Wales Health website. So symptoms is what we're looking for. If your child has symptoms, they will be sent home. You'll be asked to come and collect them if they do have symptoms. If those symptoms continue even after a negative test, it's important to remain at home until the symptoms stop, or you do a second negative test 24 hours later, or you could even go and get a PCR test just to confirm, because often they're more accurate. Once they're well enough, they can return to school. So just think symptoms is the most important thing for us to be thinking about, even if they've come up with a negative PCR test. If there is a positive test, that does need to be reported to the school, as well as obviously reported to New South Wales Health through the Service New South Wales app. Most of you know how to do that now. So under close contact rules at the end of last year, schools were included in contact tracing, and classes were declared as close contacts and those sorts of things, and that's not happening anymore. It's families and households that are included in the close contact groups. Instead, we are conducting this surveillance testing with rats. If there is a positive case, in the same way that I would let you know that there'd been a case of chickenpox or a case of whooping cough, I will let you know that there has been a case of COVID that has been a positive case, and I will let you know what stage that is in. So you can just especially closely monitor for symptoms and keep your children home if those symptoms do appear. So all staff on our site must be fully vaccinated, and that will include the third vaccination that is coming soon. So all of those people are getting that third vaccination. So all adults obviously fully vaccinated, and we strongly recommend now that all of our 5 and over students who are 5 years old and over, it's now available for them to get vaccinated. I know a lot of you will have already done that first vaccination during the holidays, and that's a wonderful protection that it offers from that severe illness. We know that it doesn't particularly discriminate around vaccinated or unvaccinated with actually contracting the disease, but the severity is hugely different, and also much less transmissible if you are vaccinated. So that's why we want all of our students vaccinated as well if possible. So we know natural ventilation is the most effective way of clearing the air, of making sure that there's not sharing of air and transmission. So we'll be having windows open, fans on, air conditioners on to try and keep the coolness happening, but that'll be difficult in the heat of summer, but we'll just have to persevere with that, as I'm sure you're doing at times as well through this summer that's no doubt going to heat up once we get back to school. So all of our staff will be wearing masks. We encourage all of our students to wear masks while they're indoors, and certainly while they're on public transport and those sorts of activities. Students don't have to wear a mask, and if you don't want them to, then please have that conversation with your student. Coach them a bit about saying, look, Mum said I don't need to wear a mask, or Dad said I shouldn't wear a mask, or whatever it is. Teachers will listen to that, but masks will be provided as extras if students want them. And so if your child is offered one, it's not because we're trying to force them, but rather we just want anyone who wants one to be able to access one. So send them along with one in their bag, and perhaps a spare as well. They'll obviously be able to take it off if they're eating and outdoors playing and those sorts of things, and playing musical instruments. Common sense would say that would be pretty difficult if you're trying to blow and wear a mask at the same time. All right. So there's information about how to help your child wear a mask on the New South Wales Health website, and I have put some of those things through Facebook in the past as well, just some little 4-step tips, but go looking for that sort of stuff on either the department's website or the New South Wales Health website. There's some really good tips about how to get kids to wear masks. We know young kids, particularly kindergarten, year 1, find it difficult to keep it on and keep it effective, but teachers will be helping with that as we move forward. As I said, visitors on site will be restricted. In the afternoons, you won't be able to come on site to pick up your children. We'll bring them out to you, particularly for our kindergarten year 1 students. That's a little bit worrying, but we got into some good routines at the end of last year, and I'm sure we'll get it happening smoothly again at the beginning of this year. So visitors who are helping with reading groups, helping in the canteen, doing those sorts of things, obviously will need to be fully vaccinated in order to continue with that volunteer help, but they'll be the only visitors that will be allowed on site. Lots of activities like assemblies and things like that obviously won't be happening, so no reason to be on site for any of those sort of visits. Swimming carnival will be going ahead, but we'll only be having competitors attend, so trying to minimise numbers attending, and in those sorts of spaces like on buses and things like that, we'll be trying to keep as COVID smart as we can through those times. and other things to do with sport and PWSA. We'll just be putting PWSA off for a little while. We're going to wait until at least week 4 before we have conversations about whether to start it up for term 1, and we may wait until term 2, the winter sports, before we get started on PWSA, if at all. It's just difficult to keep that cohort separation when we've got 3 to 6 students all on the one bus going to a sport. So yeah, avoiding high fives and handshaking, and obviously those sorts of things, if sport does resume, those sorts of procedures will be in place. So yeah, it's about minimising the spread, minimising the opportunities for people to be in small spaces together and having to share air. Watching out for those symptoms. As I said, number 1, is there symptoms? Number 2, let's conduct a rat. And that rat might pick up COVID without any symptoms. That's the idea of the surveillance testing. We'll be keeping our students together in their stage groups. They'll be playing at different times to other stages, or in the 2 different playgrounds that we've got separated at school. 8:50am start for 3 to 6 students is going to continue. That allows them to come in a little bit earlier and get away a little bit earlier at 2:50 when they finish, to avoid some congestion outside the school in the afternoon. So if you are waiting for a younger child, then you can perhaps turn up slightly later or stay out of the way as our 3 to 6s try to get away. 9am start for K-2 and a normal 3pm finish for our younger students K-2. As I said, we'll bring them to the gate, to that front gate, unless you arrange with your child. Otherwise, they can take themselves with one of the teachers. There is always a teacher going to the top gate or to the back gate. So we're going to continue to use good hygiene in and around our classrooms. There's lots of supplies like soaps and disinfectants and hand sanitizer and all those sorts of things. We've got enhanced cleaning during the day of high-touch areas like door handles and counter surfaces and things. And we'll continue to be as separated from each other as we can, certainly when we're sitting indoors, and using the QR codes to ensure we know who's been on site and in certain places during the day, so that we can inform people if there has been a case. Alright, if the worst thing happens and we do have face-to-face learning suspended for perhaps one class or perhaps one grade or a stage, we certainly hope it won't happen. But if it did happen, then there is online learning materials available. And as I said at the start of the presentation, if your child is asked to isolate at home because you have a household isolation need, there's a case in your household, then there is these units of learning per grade available on the department's website, and I will push out information to you all in the next couple of days about exactly the links to go to and where those units can be found. There won't be an opportunity for a teacher to check in with individual children, obviously, if they've got the class here at school, but your child has to isolate. You might be able to just continue their learning with some interesting other departmental units of work to do for a week or whatever it takes for that isolation. Alright, further advice for families, there's a link there for you. Obviously you won't be able to click it, but you can perhaps type it in. How do you cope if you are dealing with COVID? There's some guidelines from New South Wales Health about how to both, what the isolation requirements are, but then also how to manage at home in terms of looking after someone who is sick with COVID. Alright, so we hope that doesn't happen for you. We hope that we can keep our school open the whole time through term 1. That's certainly our plan. That's why we've got this surveillance testing in place, and we want the best chance to continue all of our students' learning journeys right through term 1 as uninterrupted as possible.